For this presentation, I'm going to demonstrate how to perform a type and screen on the Ortho gel system. There are a few important things to remember when working with the gel system. Always wear the appropriate PPE. Always keep the gel cards in an upright position. The preferred specimen is a lavender top EDTA tube less than 72 hours old. And always make sure that quality control has been performed. Quality control must be done every 24 hours of patient testing. It is important to visually inspect each card before use. Hold the card up to the light or a solid surface and make sure you can visually see a thin layer of liquid on top of each microtube. Liquid can be misplaced during shipping or from improper storage. If you fail to remember this step, you may not get a proper reaction. This visual check is especially important for cards such as the IgG that may have only a couple of the microtubes exposed. If the foil is removed even slightly from an unused microtube, it can cause it to dry out. First, we'll learn how to do a forward and reverse type on the Ortho gel system. Now let's take a look at some of the equipment that you will need for the forward and reverse type. You will need an ABD monoclonal and reverse grouping card. You will also need diluent 2+. The dispenser is calibrated to dispense 0.5 milliliters per pump. It is used for making 4% suspension of patient cells for the forward type. You will also need Ortho Affirmagen 0.8% A1 and B cells used for the reverse type. You will need to collect a patient sample in an EDTA lavender top tube for testing. Don't forget the proper PPE. Label your card with the appropriate identifiers. Write A1 and B in the boxes above the buffered microtubes. Also write the patient name, medical record number, date, time, the tech performing the screen's full last name and first initial. Remove the foil seal from the gel card. It is good practice to ensure that the foil has not been previously damaged or removed from the microtubes. To make the 4% patient suspension, you'll need to label 2 test tubes. One with diluent 2+, one with 4% patient name and medical record number. Dispense 1 pump of diluent 2+ in the test tube labeled diluent 2+. Using program 7 on the automatic pipetter, pick up a pipette, draw up 200 microliters of the diluent 2+ air, open your patient sample, put it to the bottom, pick up 10 microliters of patient packed red blood cells, put it into the tube labeled 4% with the patient's name, and mix, and you're done. Using program 9 of the automatic pipetter, pick up 60 microliters of patient sample and dispense into well A, B, D, and D control. Now we're going to be doing the reverse type with the Affirmagen cells A1 and B. Gently suspend the cells in the bottle. With program 1 on the pipetter, aspirate 50 microliters of A1 and place it into the A1 tube. Using the same program, pipette 50 microliters of bottle B and pipette into the appropriate well. Now to finish the reverse type, aspirate 50 microliters of patient EDTA plasma using program 1 of the pipetter. Dispense it into tube A1 and 50 microliters into tube B. Now place the card into the centrifuge with an appropriate balance. Close the lid and press the start button. The card will centrifuge for 10 minutes. During this time, do not open the centrifuge or your results will be invalid and you'll have to start over. This patient is A positive. Note the positive reaction in the A and D wells of the forward type and the positive reaction in the B cell well on the reverse type. The range of reactions are as follows. 0 is a negative reaction with no agglutination present. There is a solid button present in the bottom of the tube with no red blood cells dispersed throughout the tube. 1+ through 4+ shows agglutination or hemolysis of the red blood cells and is a positive result. Red blood cells may remain suspended on top of the gel or are dispersed throughout the gel in varying degrees. Red blood cells may form a button in the bottom of the microtube in some positive reactions. MF stands for mixed field reaction and should be interpreted with caution. The presence of fibrin, clots, or particulates may cause some red blood cells to become trapped at the top of the tube. Mixed field reactions are generally only observed in tests containing a dual population of red blood cells, such as a transfused patient or a bone marrow recipient. Use this table of reactions to help determine the patient's blood type. The following are some reasons for false positive or false negative reactions. Bacterial or chemical contamination of test materials, aged blood specimens, inadequate incubation time or temperature, improper centrifugation, improper storage of materials, omission of test samples, using a gel card that has dried out or is missing the liquid from the top of the microtube, or using a cell suspension that is not mixed properly. Now we are going to learn how to perform an antibody screen on the gel method. It's a good idea to start the antibody screen first because of the 15-minute incubation time. Then you can start the forward and reverse type while the antibody screen is incubating. Let's look at some of the equipment needed for performing an antibody screen on the Ortho gel system. MTS anti-IgG screening cards. Selectogen 0.8% cells 1 and 2. EDTA patient plasma. EDTA patient plasma. Don't forget the proper PPE. Divide the card and label the IgG microtubes with the correct identifiers. Label for screening cells 1 and 2 in the boxes above IgG. Put the patient name, medical record number, date and time, full last name and first initial of tech completing the antibody screen. Keep in mind that you only have to use 2 of the microtubes per patient when performing an antibody screen. Remove the foil seal from the individual microtubes that are going to be used for testing. Since you only have to use 2 for the antibody screen, be careful not to uncover any of the other tubes, or they might dry out and give you a false reaction the next time you use the card. Now we're going to add screening cells 1 and 2 to the gel card. Gently suspend the cells in the bottle. Using program 1, pipette 50 milliliters of screening cell 1 into the tube labeled 1. Change pipettes, and using program 1, pipette 50 milliliters of screening cell 2 to the appropriate microtube. Now we're going to add patient sample to both microtubes. Using program 4 on the automatic pipetter, aspirate patient sample and expel the first drop back into the tube. Pipette 25 microliters into 1 and 2. Incubate the card in the incubator for 15 minutes. When the 15-minute incubation period is complete, place the card in the centrifuge with a balance and centrifuge for 10 minutes. Grade the reactions and record in the blood bank record book. This patient has a negative antibody screen. Congratulations! Now you know how to perform a type-in screen on the Ortho gel system.